Now, in order for a vaginal delivery to be successful, the baby must come through the cervix. So if this placenta is blocking the cervical opening, then it makes sense that a vaginal delivery may not be possible or may be very complex. Hello, moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. Make sure you hit the subscribe button and then turn on your notification bell so that you can join this growing community of learners who are empowered in their own maternity health journey. Make sure you also look around at some of the other topics that have been covered as they may effectively address your needs. For the past couple of weeks, I have addressed maternal and fetal factors that may lead to a Caesarean section. In this week's video, we are going to cover things that neither mom nor baby can control. However, keep in mind that the information covered in these videos are for educational or informative purposes only. Make sure that you are working very closely with a doctor who is well versed in your healthcare so that when a plan of care is created, it addresses your needs specifically. Without further ado, we're going to jump in right away. One of the main reasons why moms end up needing cesarean sections is because their labor is either stalled or excessively prolonged. Now, there are certain things that can cause a woman's labor to be prolonged unnecessarily, and they include being induced before her body or her baby is ready to be born. Also, if a mom receives an epidural while she is in labor, that epidural can kind of slow things down or completely stop labor altogether. If a mom is also carrying a large baby, there's also an increased chance that that baby may be so large that he or she is having a hard time fitting into the birth canal, and that can prolong the process. Also, if you are a first-time mom, your body has never done this before, so there is a chance that your body may need a lot longer time to accomplish this than a woman whose body has experience in this area. Now, what happens is a woman can be having contractions, but they are either too short for them to be effective, or they are lasting the right amount of time, but the contractions are weak. Either way, the cervix is not effectively being dilated or thinned out to allow the labor and process to move along quickly enough for mom and baby to be delivered in a sensible amount of time. Should the labor continue to be progressed or stalled for too long, the baby can begin to have issues such as low oxygen levels. The baby can go into distress. If the woman's amniotic sac has been ruptured, there's also an increased chance for infection because baby is now exposed to the external environment. So if this is a woman's situation where her labor is going on and on and on, and they've checked and her and baby are doing well, the doctor may say, let's go ahead and watch for a little longer. Or if baby is in distress, then he or she may recommend a cesarean section. Another thing your doctor or midwife may want to do is to give you the artificial hormone known as Pitocin, which can help to make your contractions stronger and closer together, and see if that can help things get moving along. But if that does not work, then most definitely, if baby, especially baby, is in distress, then it may be necessary to perform a cesarean section. Another reason why moms may need a cesarean birth is if she experiences something known as a cord prolapse. Now, a cord prolapse is a medical emergency where the baby's umbilical cord is compressed either between the baby and the mom's pelvic bone, or the cord delivers before the baby. If the cord has emerged from the cervix before the baby, then the baby's head or whatever the presenting part is can compress that cord, effectively cutting off your baby's blood supply, which also cuts off your baby's oxygen supply. And then it causes toxic waste and other things that mom would help baby flush out of his or her body to now begin to accumulate in your baby's body. So if your baby's cord is the presenting part, not your baby's head or leg or whatever other part is the presenting part, that is a medical emergency, and your doctor will work very quickly to ensure that baby is delivered so that his or her health is preserved and that your baby does not have any lasting negative outcomes. Now, some of the risk factors that can predispose a woman to having a cord prolapse include pregnant with multiple babies. Multiple babies tend to be smaller than the average size of a singleton baby. So there's a chance that the cord can slip through and become the presenting part. Also, if the baby is a singleton baby, but his baby is born prematurely, then there is a chance that because the baby is too small, the cord can get between the baby and the uterus or between the baby and the pelvis and become compressed. A third reason why a mom may need a cesarean delivery is if she experiences something known as a placental abruption. A placental abruption is simply the detaching of the placenta from the uterus before the baby is delivered. There are certain risk factors that put a woman at risk for experiencing a placental abruption, and that includes any kind of trauma, which means being struck, falling down, or being in a motor vehicular accident, Women with very high blood pressure can also experience this detaching of the placenta from the uterus. Also, women who smoke or use any type of illicit drugs during their pregnancy predispose or increase the chances that they can experience a placental abruption. It can also occur if a woman has an infection in her uterus and that infection is not actively treated. Some of the signs and symptoms that a woman can experience to indicate that an abruption has happened include belly or back pain, vaginal bleeding, an abdomen that feels very rigid or hard, and contractions that follow one another in rapid sequence. If your doctor or provider determines that an abruption has occurred, he or she may want to hospitalize you to monitor you to see how baby is doing. If baby is doing okay, you may be put on strict bed rest so that your baby can be given the opportunity to mature just a little bit more while your doctor or provider gives him or her medications that help mature the lungs. If your baby is dealing with any kind of distress following the abruption, then an emergency cesarean section may be indicated. A fourth reason why a woman may need a cesarean delivery is if she experiences something known as a placenta previa. A placenta previa is when the baby's placenta either partially or completely covers the cervical opening. Now, in order for a vaginal delivery to be successful, the baby must come through the cervix. So if this placenta is blocking the cervical opening, then it makes sense that a vaginal delivery may not be possible or may be very complicated. Now, there are certain things that may predispose a mom for a placenta previa, and that includes being pregnant with multiple babies or having any type of uterine scars, or women who smoke or use drugs during their pregnancy, women who are pregnant with more than one baby, or just period, a woman who has had a baby in the past. Because a placental previa can cause a woman to bleed throughout her pregnancy, your doctor or provider may caution you to avoid certain activities that may increase the likelihood of bleeding. And those activities include any kind of sexual activity, any kind of douching or use of tampon during your pregnancy. Your doctor may advise you to avoid any high octane sports such as jumping, running, or even squatting. He or she will definitely caution you to stop smoking, as smoking leads to so many negative outcomes in both mom and baby during pregnancy. Keep in mind that placental previas can resolve during pregnancy, meaning that the placenta can move away from the cervical opening to a more favorable point, such as the side or the top of the uterus. However, if the placenta does not move away from the cervical opening and a woman gets to the point where she is ready to deliver, then your doctor or your provider may advise you to deliver by cesarean section, because if you persist to deliver through the vaginal canal with a partial placental previa, then you stand a higher chance of bleeding following the birth of your baby. So to minimize the risk of hemorrhage or any kind of risk to both mom and baby during the birth of the child, your provider may recommend a cesarean birth. Now, last but certainly not least is something known as uterine rupture. Uterine rupture is incredibly rare, but it is a potentially serious cause for an emergency cesarean section in a mom. When a woman is pregnant, her uterus acts as a barrier between her abdomen and her baby. If that uterus ruptures for any reason, it causes the baby that was once in a very enclosed space to now be exposed to the content within a mom's abdomen. Because of this, an emergency surgery must be done to spare the baby's life and then potentially stop any bleedings or negative outcomes for the mother. It is very important to keep in mind that there are certain things that can predispose a woman to a uterine rupture, and that includes being pregnant with multiple babies. A lot of times in cases where moms are pregnant with 3 or more babies, a woman who has a previous cesarean section is also at risk for a uterine rupture. And then women who have had any kind of surgery on their uterus, such as fibroid removal, are also at risk for uterine rupture. Now, as I previously mentioned, the risk is very, very low, but I just want to put this out here because I've been reached out to many women asking questions, many women wanting answers. And if anybody has any further questions that they would like addressed, even if it's some of these conditions that have already been covered here, I will be more than happy to further elaborate on it. If you have learned something from the content of this video, make sure you share it with somebody who you believe can also learn from it. And then make sure you hit the subscribe button so that you can come along with me as we grow this community of learners who are informed in their own health care. I wish you a happy, safe, and healthy pregnancy. And until the next time, be blessed.